So in this module, we look at breastfeeding, positioning, and attachment. Our objectives for this particular module are that you understand the importance of correct position and attachment, how to identify a good position, how to identify good attachment, the different positions that may be used for feeding, as well as some scores that can be used to assess feeding. So position refers to the alignment of the mother and the baby, whereas attachment is more about the grip that the baby's mouth has at the breast. Both of these are extremely important for a successful and pleasant breastfeeding experience. Improper position and attachment leads to cracked, painful nipples for the mother, as well as a baby who's always crying, demanding feeds at frequent intervals, and not really gaining weight. Soon after delivery, these are skills that all healthcare professionals need to teach mothers. So coming to positioning, the first point is that mother and baby should both be comfortable. The newborn's head and body should be held in a straight line. The baby's nose should be opposite the mother's nipple. The newborn's body should be turned towards the mother and kept close to her. And the whole baby's body should be supported, not just the neck and shoulders. The supine position is one in which the mother lies supine. This could be used soon after delivery, especially after a cesarean section. In this, the mother doesn't even need to turn. The baby is placed onto the mother such that he can put himself in a good position. The lying down position is a similar position. However, in this, the mother lies on the side, and therefore it's also called the side lying position. This is useful for night feeds, although we must exercise some caution for preterm babies, babies who are low birth weight, or sick newborns. These may aspirate, and therefore this position is not advised for this particular group of babies. The cradle position is a traditional position commonly used in India. In this, the baby feeds from one breast while the same side arm supports or carries the baby. A variation on this is the cross cradle, where the baby feeds from the opposite side of the arm that is actually carrying the baby. Either of these can be used completely depending on the mother's comfort level. The football position is one in which the baby is held under the mother's arm. He doesn't go across her body. And therefore, this is particularly useful for twins where each baby can be held on one arm and they could be fed simultaneously. It can also be used for a cesarean section because a baby doesn't lie near the mother's sutures at all. The dancer's hold is something in which the baby's jaw is supported, and hence this is useful for babies who are hypotonic, particularly those with Down syndrome. The straddle position is in which the baby is completely upright, and therefore this decreases the chances of any aspiration. This is particularly useful for babies who have a cleft palate, as well as during KMC, where the binder just has to be loosened and the baby can easily be put to the breast. So after the different positions, we come to attachment. In attachment, there are 4 points. The baby's mouth should be wide open. The lower lip should be turned outward. The chin of the baby should touch the mother's breast, and more of the areola should be seen above the baby's mouth than below it. So the correct position, you see that all these 4 points are met, whereas while in the incorrect position and attachment, they are complete. None of them are actually met. Now, when a baby is well attached to the breast, the baby will be calm, the baby will be relaxed, the mother will not feel any pain while feeding, and the baby's cheeks may become full while the baby is actually sucking. This is a link that one could use to see some videos on how this can be done easily. Now, lastly, coming to the assessments, the breast assessment tool assesses breastfeeding as a whole. So it has a column which says that breastfeeding is going well and points under that. It also has a certain list of points which say that there are possible signs of difficulty and these need to be addressed. The LAT score is a score which has been widely validated. This mainly looks at attachment and it has a maximum score of 10. So in conclusion, good positioning and attachment is the key to successful breastfeeding. This needs to be taught to mothers and their families soon after birth, and the LAC score can be used to assess attachment. Thank you.